Hello everyone. Welcome to JNUC 2020, using Jamf virtual visits. I am pausing here for a brief moment for you to review our forward-looking statement. It will also be available for a detailed review if you'd like under Resources. And today, I'm thrilled to be joined by Eric Boyd. Eric?
Thanks, Jonathan. I'm Eric Boyd with UC San Diego Health. I'm an infrastructure architect with UC San Diego Health, and what that means is I manage all of our Apple devices so that we can make the best use of the experience for our staff and our IT staff, and of course our patients.
And I'm Jonathan Uresco, an implementation engineer here at Jamf. Implementation engineers work with current and prospective customers to develop unique and advanced workflows, and two, build out integrations to further enhance their implementation of the Jamf platform. The end goal is to streamline operations, make the lives of the IT admin easier, and enhance their clients' user experiences. This particular integration was one I'm so incredibly honored to have been a part of. Eric will walk through the tech of UC San Diego Health and how day-to-day operations were pre-pandemic. He'll then go into exactly what happened when COVID hit and how they needed to act quickly. From there, we'll dive into a bit of the development of how we went about tackling the issue, how we used technology that currently existed to keep people connected, and finally, we'll introduce you to virtual visits powered by Jamf. The floor is yours, Eric.
Thanks, Jonathan. Well, certainly no one was fully ready of a pandemic of this magnitude. We were lucky enough to have a few key pieces of technology already deployed. Some of you may recall from our previous JNUC presentations that we already had an iPad in every patient room, ready for that patient to set up and use throughout their stay. The patient could already use Facetime, Skype, Facebook Messenger, and a few other apps to communicate with friends and family. In each room of our Jacobs Medical Center, we have an Apple TV for the iPad to do AirPlay streaming, and a Crestron controller to let the patient control the lights, blinds, TV, room controls, etc. And to protect the patient's information, we automatically wipe the iPad on discharge or transfer with the help of Jamf's HealthcareListener. This fully automated process eliminates the need for IT or clinical staff to set up or reset the iPad. In early February, we received our first COVID-19 patients. We were able to extend our iPads to them as well. So how could we improve upon this platform to conserve PPE, reduce contact, all while maintaining our levels of care and avoiding additional risk to our already established safety protocols? As the organization started ramping down non-essential and elective procedures, we were able to redeploy the iPads from the inpatient setting to support physicians doing remote outpatient video visits. Our EMR, Epic, already had apps that we were able to rapidly deploy to enable video visits. However, we had a new challenge. There wasn't already a system in place for conducting these video visits with inpatients. So if the patient's already in our hospital, the idea was, well, just go visit them. However, putting on your PPE, visiting with the patient who's also wearing a mask, leaving the room, removing your PPE, following cleaning protocols, putting on another set of PPE to meet with your next patient. This process takes an additional 10 to 12 minutes per patient. This isn't very efficient at all, and we need a better way. So without changing or adding anything, we could just call into the patient room on their bedside telephone. No need to work, but what a terrible experience for everyone. Well, we are also a Zoom shop, so we could improve upon this pretty easy. The first step we could deploy was Zoom to all of our bedside iPads. And thanks to Jamf and Apple School Manager, this only took 20 minutes to add Zoom to all of our provider and bedside iPads. The provider could start a meeting on their device of choice and then call the patient on their bedside telephone and give them the meeting ID. It's not awesome, but hard to beat the deployment time. Plus, the provider can email the meeting link to a friend or family member so that they can join the meeting as well, since obviously visitation and family members coming to meet with the patient, not really a good idea at the time and was heavily restricted. So this worked for the most part. However, as you can imagine, there's several different problems with reading the phone number or the meeting number over the phone. The patient might not hear it correctly and misenter it, and the patient might not be familiar with the platform, and the provider might be in a rush and transpose some digits. So there's a lot of room for frustration there. And those of you who know me know I love automation, and this wasn't really, cutting it. All of the onus was on the patient and the provider, and this wasn't a great experience. Additionally, if another provider needed to talk to that patient and that patient was already meeting with another provider, that put the onus on the patient to decide who they needed to be speaking to. And we don't want that. So we reached out to the Apple community, and turns out a lot of others were having the same issue. But one Friday evening, a Jamf responded.
Thanks, Eric. Remote healthcare was indeed not brand new when COVID hit. However, it was new to have implemented it inside of a hospital. Just months ago, remote care tools were for patients at their homes or where the providers weren't able to physically be in the same space. The hospital quickly turned into a similar remote scenario, yet the implementation and infrastructure didn't quite translate the same as the tools and tech already deployed inside of a hospital differed from that the users remotely. So we needed a solution like yesterday, meaning the quickest way to a solution was to get the most out of the devices, software, and resources, and some of the workflows that were already deployed. The end goals were to connect patients to their providers and patients to their families, all while maintaining a safe distance. Saving personal protective equipment was vital, COVID or not, and we needed to do so by providing to the patient without being in the same room. On top of that challenge, patients' families had visiting restrictions, and in most cases, at the beginning, no visitors, then one, maybe two. Of course, there are other players when discussing devices and software, IT. So when we needed to keep IT both safe and out of the loop with this process, meaning automation. And finally, we needed to make sure that whatever we did was secure for all parties and no private information was disclosed to outside parties. I personally love tough challenges, and I was extremely motivated to take this challenge on, so I immediately began thinking. Jamf has a tool in healthcare called HealthcareListener. The HealthcareListener uses the medical facility EMR, or electronic medical record system, to determine patient status. When a patient is admitted to the hospital, a message is sent and the HealthcareListener can do something based on that action. 2. When a patient is moved or discharged, the HealthcareListener can do something else. In a standard implementation, this HealthcareListener provides us a way to provision a device and wipe a device automatically. There is no IT intervention. UC San Diego, like many healthcare institutions that use Jamf, already have this implemented. I wanted to see if we could plug into this tool in order to tackle our solution, and if it provides automation capabilities, even better. Cool. So we've potentially removed the manual IT intervention from the mix. That's a big one, as whatever we create needs to be as simple as possible for the patient or patient-side caregiver, and would need to be repeatable without someone physically touching the devices. UC San Diego already had iPads deployed, and they were using HealthcareListener. We probably could figure out something in case the HealthcareListener couldn't be used, but for now, it looks like that could check off two requirements. Now, when dealing with healthcare or truly anyone's lives, any communication needs to be secure, even more so in healthcare, as there are privacy laws that come with hefty repercussions if violated. Every organization has some inter-office communication, from email to instant messenger to video conferencing. There are a lot of different video conferencing tools, and I knew there must be a way to use what's currently implemented to benefit the solution. If we are using a currently implemented conferencing tool, we could create accounts for each device and post the account information somewhere close to the device or on the device, and we could just log into the device after each patient gets admitted and discharged. There were issues. What if that sticky note goes missing after you adhered it to the device? IT needs to be called. What if they wipe the whiteboard that had the info on it in the room? IT needs to be called. What if the patient logs into their personal device with the credentials that were for the hospital visit? IT cannot remotely wipe that personal device. And using the same credentials presented us with a security problem. When you reuse accounts, previous call history and potentially chats are saved. This is a huge no-no. End result? Make an account for every patient. To be completely secure and private, we needed to make that new account for each patient. We can ensure the devices are wiped after the patient is discharged with the HealthcareListener, and that means that the devices will not retain previous login info from the previous patient. And with the help of the HealthcareListener, that securing of the device becomes automated. No IT intervention needed. So now we can dive into the specific communication tool and how we can create that link between the patients and their providers and their loved ones. The first thought is Facetime, as Eric mentioned. Since UC San Diego already had Apple devices deployed to the patient rooms, the obvious go-to would be Facetime. However, Facetime comes with hurdles. There are no one-time links or join now links in Facetime. Facetime requires a login, and you need to be logged into the device to start or receive calls. We could make a bank of accounts and distribute those accounts, but there is no way to create and delete automatically. We could have done that, though, for a short time as to accommodate and get the solution out the door. But what about the ones on the other side of the call? The providers and the family. Providers might be on any device, a Windows computer, their personal phones, and maybe they're in the hospital or maybe they're not. And we could not have the device manufacturer be a limiting factor preventing care. 2, even if we have the device logged in with FaceTime, the patient's family may not have access to a FaceTime-capable device. And as they weren't allowed inside the hospital, in most cases, I needed a solution that was a little more inclusive. That led us to Zoom. UC San Diego, as Eric mentioned, already uses Zoom, so let's use Zoom. Zoom, like a few other video conferencing platforms, has automation capabilities, and they have Meet Now links that require no login, but instead use a password or waiting room. Awesome. We have, hypothetically, met all of the preliminary requirements. We'll be using iPads and securely create accounts for patients to connect with their providers and family in an automated fashion. Now comes the work. Putting 2 and 2 together and developing this solution. The timeline required for delivery had an optimal deadline of, well, yesterday, or realistically, weeks or months ago. This came so fast, and the environment was ever-changing. We needed a solution immediately, and I had promptly got to work, even before we had that first meeting with Eric. This instantly became a passion project for me, and I refused to stop developing and working on it until I had something that worked. And in just a couple of days, we had implemented the solution. Virtual visits. Virtual visits powered by Jamf uses automation to connect patients to their family and patients to their loved ones in an easy-to-use and secure manner. Once a patient is discharged, using that healthcare listener, the device is wiped, and if an existing Zoom account or link was made for that device, it is automatically deleted in all systems. Once a new patient is admitted, a device is assigned and configured automatically with Jamf. And this includes an integration that uses Zoom to create a unique account for that patient to use throughout their visit. What's the configuration process? Well, automated device enrollment enrolls the device into Jamf once Wi-Fi is joined, and attributes inside of the device record tell Jamf to deploy necessary apps to that device. Along with the apps is the Virtual Visits web app that contains the Zoom credentials and a personal link. This link comes secured with a password to maintain security, and with this link, providers and specialists can remotely connect to their patient together in one conference. And patients' families can receive the link as well for multiple party conferences or virtual visits with their loved ones. This solution saves on personal protective equipment, allows patients to be connected with their loved ones from a safe distance, and importantly, have that essential face-to-face communication. I'll have Eric discuss their implementation. Eric.
Thanks, Jonathan. Our server team was able to provision us a new server within a couple days of us talking with Jonathan and figuring out what our requirements were. We were able to deploy Jamf Video Visits very, very quickly. This allowed us to automatically deploy a unique web clip that would kick off the Zoom meeting and the provider a clip to join their meeting as well. And as Jonathan called out, this is automatically generated on each visit and deleted at every discharge. Now, multiple providers can join in and talk with the patient at the same time, as the meeting ID is tied to the patient, not to the provider. The providers could see that the patient had set up their iPad from the directory that Jamf had helped build. The directory allows the provider or the care staff to filter down to just the buildings or the floors that they have patients in. Now multiple providers can join in and talk with the patient at the same time. The providers can still email friends and families the meeting link and also send that to friends and family that the patient would like to meet with. This isn't great for the patient, though, as it's still heavily dependent on the provider. So we can probably improve this further. By deploying another web clip, we can provide the patient the ability to not only log into Zoom with their temporary account, but we can also let them email their friends and family directly. Of course, they can already copy the link and share it with friends and family over the already available social media apps. But being able to email friends and family that maybe are on a different platform or maybe not have those apps already installed on their personal devices, this gives them an easy way to implement this quickly. So here you can see we've now deployed 2 different web clips and a Zoom app onto the dock with that top web clip giving the patient the ability to email their friends and family. Now, before I send it back to Jonathan, I wanted to call out and thank all the people who helped make this possible. Of course, Adam Mahmood and Christopher Ball from Jamf. And seriously, Jonathan, we could not have done this without you. With UC San Diego, of course, I want to thank Mark Silvestrek, Jeff Smith, Todd Porteous, Christopher LeBron, Brittany Partridge, and Kyle Ficklin-Babloni.
Once the solution was ready for UC San Diego, it was truly an all hands on deck, let's get this implemented as quickly as possible situation. From the get-go, we knew nearly every hospital and care facility was going to need something like virtual visits. So our team at Jamf got to work building out the infrastructure to build out and support virtual visits integrations for any of the customers that wanted it. Though we do still have an on-prem version, we highly recommend our Jamf Cloud implementation. Quicker implementation, upgrades and enhancements, including the new SMS functionality, stability, reporting and remediation, and hey, who wants to not host another server and maintain it? Not only have we made it as simple as possible for patients, providers, and the family, but we wanted to make it easy for any organization to deploy, server or not, as COVID was hard for the patients and families, but let's not make additional technical overhead another pain point for IT. Dozens of virtual systems around the globe have implemented virtual visits powered by Jamf, including NHS trusts like Oxford, who you saw in the keynote. A great example of the impact can be seen at Alberta Health Services in Canada, who powered 10,000 visits and 100,000 visit minutes within just 3 months of go live. Again, passion project for me, genuinely helping people. Virtual visits comes in two primary flavors, patient to family and patient to provider. A healthcare organization can choose to use one or both of these in their environment, and we can help customize the experience and tune it to fit the use case. Any Jamf customer setting up Apple devices for the purpose of telemedicine or communication between patients and their loved ones may use their Jamf products for those devices at no cost through December 2020. Non-customers can purchase the minimum number of licenses to take advantage. Virtual visits, however, is available at no cost, and no minimum purchase is required for non-customers to take advantage. For questions or to get your hands on virtual visits or Jamf's healthcare solutions, check out jamf.it/JNUC2020VV or scan that QR code. Thank you.